The news of this week is weighing so heavily on all of our hearts and all of our minds. A lot of us struggling to come up with the words to describe how we're feeling and what we're thinking about what has happened in Uvalde, especially when it comes to talking to our kids about that. So in today's KSAT Q&A, we have Dr. Barbara Robles-Ramamurthy with UT Health San Antonio, a child and adolescent psychiatrist. Doctor, thank you for being here. This is a really, really difficult week. And I want just to start this conversation about just that. Where do you start to talk to a child about what they're hearing and what has happened?
Yes, thank you both for having these important conversations. We want to be having these tough conversations on a regular basis right now when tragedy strikes. But certainly it's important that we all learn to have these difficult conversations. In a way, I think it's good that we're all struggling so much to hear these news because these are not normal news. These are not things we want to be seeing on a regular basis. And so I think that's the first step, to say that this is a very human response that we're all having. This pain, the depth of, how deep it goes. It shows us that we all care about each other, about life, how sacred life is. And so we can acknowledge that first and then be okay with that pain, learn to feel it and learn to navigate it.
It's just, it is so difficult because these are things our children are going through that many of us didn't at that age. So what do you say? What are tips for talking to either your youngster or your adolescent about what happened, what played out in Uvalde?
Yeah, so I've been talking to a lot of journalists and we're happy to share some resources, but basically we start with where your child is in terms of developmental stage, their ability to process this information and what they have heard already, what they already know. So asking questions, open-ended questions, and listening to what they're telling you, observing their behavior. How are they responding? Are they seeming more anxious? Are they needing more support, more reassurance, more connection? Those could be signs that they're feeling the stress, whether or not they know the news, that the situation. And so understanding what they know already, that's where we want to start. And then you can, based on what they already know, you can see what questions they have and how you can support their understanding and answer them little by little, allowing them to ask more questions, show you that they're processing the information or how they're processing. And then you take it from there based on, where they want to take it, how deep they want to take that conversation. And I think, it's important that we as adults learn to have these really tough, painful conversations, because when we are feeling the pain, we may not want to talk about it with the little ones, but they're hearing this news. They might be hearing from friends at school or on social media. And so it's important that we open up those spaces for them.
Yeah, I'm glad you brought up social media, because it is such an influence, especially on teens and, kids who are of an age where they have their phones in their hands all the time. But I have on social media heard parents say, I want to shield my child from this. I don't want to talk to them about it because I don't want them to fear school. And I'm just curious, in this day and age, like Steve said, this is a part of our kids' lives. They are going through active shooter drills. These are conversations that they're having in school. Do you think there is harm, or is it to a child's detriment not to talk to them about what has happened this week, not to have that conversation? And I'm sure age plays a factor in that too, but I'm curious to get your thoughts on that.
Yeah, so with the little ones who may not be exposed to news, radio, TV, or other people outside the home, it's definitely, not necessary for them to know if there's no need for them to hear this news. But I do want to remind parents that a lot of times adults do have sensitive conversations around little ones, thinking that they might not understand or maybe listening. But I can tell you, I have a 4-year-old who hears everything I say, and he does follow up with questions. And so keep that in mind. Just because you're not talking about it doesn't mean they're not listening to other people talk about it. In terms of shielding our kids from the hard reality that they are living, it's just impossible once they get to school age and beyond, especially once they have a phone and they're accessing social media. It's just impossible to shield them from these news. And so I really strongly encourage parents to find ways to talk about these hard conversations. It's not easy. I'm not pretending that it's easy. None of us want to have these conversations. But throughout time, psychology has taught us that opening up those conversations regarding those difficult topics that are taboo in our culture or are difficult, such as, for example, death, sex, drugs, all of these things, we know that parents and families who open up those spaces for kids to learn from trusted sources of information tend to do better than when they try to navigate this information by themselves, and we don't know where they're getting their information.
I know you're a child and adolescent psychiatrist, but for adults, isn't it also important for us to admit that we're not okay, that this is affecting us, that this is troubling us, what happened in Uvalde, and then and do we let our kids see that?
It is absolutely necessary that we start having these very tough and honest and open conversations as adults, because we often don't talk about these things. It's loss, grief, hardships, all of these things are part of our human experience, and we have to learn how to talk about it. And so it's extremely important. And as a child psychiatrist, I think it's even more important that we learn how to have these difficult conversations when we have kids and when there's kids around us, because educators, right? So anyone who's working with kids need to learn how to process these difficult experiences so that they can know how to talk about it with the young ones. Absolutely.
It's difficult to know where to start, but the point is just start somewhere.
You don't have to be perfect.
Yeah.
Yeah.
Or have an explanation.
You can do lots of listening, and you can learn to just let people express their emotions, their experiences, their opinions without having to guide them all the time. So we can all learn how to do that a little bit better. And by listening, we can learn how to express ourselves as well.
Dr. Robles-Ramamurthy, thanks so much for being with us. I appreciate it.
Thank you for having me.